Good evening, you're now with me, Lorenzo Isaac, for TVS Nightline. Here are the headlines for tonight. Sarawak advances healthcare access with telemedicine and rural specialist services. Government reviews child protection laws amid rise in exploitation cases. In world news, Air India flight makes emergency landing in Phuket after bomb threat. The Sarawak government remains committed to transforming the state's healthcare sector through innovative approaches, including the implementation of telemedicine and the expansion of specialist services to rural areas. Sarawak Premier Dato' Petinggi Tan Sri Abang Johari Tun Openg said this initiative is in line with the state's goal of balancing tradition and innovation, a crucial combination in empowering the state's healthcare system.
Here in Sarawak, we understand this balance between tradition and innovation deeply. As mentioned, we are a land of centuries-old tradition, live alongside cutting-edge initiative, from preserving our indigenous culture such as OHA to pioneering efforts in green energy, digital economy, and biotechnology.
Speaking at the 51st Annual Scientific Congress of the College of Surgeons at Borneo Convention Centre, Kuching today, Abang Johari said the Sarawak government is now rigorously expanding the use of telemedicine and improving access to medical expert services to the entire state, especially rural areas.
In the healthcare sector, we recognize that innovation is crucial to delivering better outcomes for our people, particularly in rural and remote areas. Our goal is to ensure that every Sarawakian, regardless of geography, has access to the highest standards of care.
Innovation in medical science must be done with a strong sense of responsibility, particularly amid rapid technological advancements in modern healthcare. Sarawak Premier Dato' Petinggi Tan Sri Abang Johari Tun Openg highlighted that AI has already shown promising success in assisting patients with physical disabilities.
I read with interest the development of biomedic in the realm of medical fraternity, particularly the combination of artificial intelligence, AI, in solution gathering. In his book, this is the book that I read, Dr. Jordan Nguyen, he's a biomedic researcher, and in summary, he had this problem of patient with physical disabilities. And what he did was he innovated machine that connect the minds of the machine through intelligence to the patient. And this connection between the artificial brain and the human brain seemed to be successful.
He explained that the technology offers hope for patients to regain control of their movement and behavior through neural connections powered by AI. However, the Premier also raised concerns of the risks of such technology being exploited commercially without proper regulation.
Second scenario, it may become a business model for those who are profit-oriented. One is for humanity, the other becomes business entity, which we profit-oriented. If it is a commercial entity, the question next is where is the balance? To people who can afford it, they have this access, but those who are unable to pay the costs may be out of that spectrum.
Meanwhile, he called on policymakers, medical professionals and scientists to work together in developing approaches that ensure medical innovations are accessible to all, regardless of financial means. The government is reviewing child protection laws following a worrying rise in cases of sexual exploitation involving minors. Women, Family and Community Development Minister Dato' Sri Nancy Shukri stressed that they will not remain silent on the issue. She said the review also covers the protection age limit following the recent controversy over the Facebook group Budak-Budak Sekolah Rendah, allegedly sharing indecent images of children. She added that her ministry acknowledges public concern but has chosen not to issue further statements out of respect for the investigation process currently being conducted by the authorities.
Maybe if I mention it will be too early untuk saya bercakap. Let them do their job first. For my part, I have been asking. Saya minta supaya, especially on children sampai berapa umur macam Australia kan. Tapi I cannot say it now because itu di bawah MCMC. Jadi if you quote me also mungkin tak betul because only the minister would know what is it dalam perancangannya. Jadi sebab itu I'm just telling you memang kita bukan duduk diam lah.
Local media reports revealed that the Facebook group had existed since May 2014 and amassed more than 12,000 members. Its content reportedly included images of children uploaded without consent, accompanied by lewd captions and comments.
I know there are some comments about why we did not say anything, but I think the best is to leave it to the police.
As of Wednesday, the group was no longer accessible on the platform.